I met Dr. Janelle Goetcheus in 1990.
I'll never forget that moment when we were introduced.
The occasion was actually a sad one. We were both attending the wake service of Mitch Snyder.
Mitch Snyder was a person who was a very strong advocate for those who were homeless.
At that time, I was looking to transition out of the position I was in at that time.
Healthcare for the homeless at that point were seeking a CEO, and out of God's providence, Vince was chosen.
We are providing healthcare services and social services to the most vulnerable in the district.
Vince has so many wonderful gifts that I don't have. He's so engaging with people. He can build bridges because of his warmth and friendship.
I told her many times, I know nothing about medical care. I know a little bit about managing people and telling them what to do. But of course, Janelle is, you don't tell her what to do. She usually tells me what to do.
Now, unlike today, nearly everyone had no coverage at all. And so we did a lot of begging.
She had worked at Christ House. She had done a whole lot of work with her family dealing with social inequities and healthcare inequities. So healthcare for the homeless was a logical outgrowth of her sense of service.
In 1995, we were approached by the Bureau of Primary Health Care in regard to becoming the overseers of two large federally funded health services here in D.C., Upper Cardoza and east of the river. At that point, our name changed. We were no longer Healthcare for the Homeless. We were now Unity Healthcare.
I had a good relationship with the federal government, so we were always looked at it as a cooperative thing.
The city made the decision to close DC General, and connected with that were 6 community health centers that Unity became the overseers of.
I don't think I would ever have even imagined the depth and the breadth of what Healthcare for the Homeless, now Unity Healthcare, has accomplished.
In his leadership, he will be remembered. His compassion, his deep care for those, particularly those who have been underserved medically. And
I believe the one she would want is to be remembered in the hearts of the people she has served, in the people she has dealt with, in the healing she has brought to so many people in Unity and Christ House.
I think sometimes we think that we have to see all positive results in what we do, and that isn't always possible, even on an individual basis working with particular patients. But I just want to be known that I was obedient to what God was asking.